National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopathic Doctor Jonathan Beatty here again for Nationalnutrition.ca. Today I want to discuss with you a condition that often presents in my office, asthma. I actually grew up with the condition. For me, it was related, weirdly enough, to a dairy allergy. And for myself, actually, when I removed dairy from my diet, my asthma went away. So today we're going to teach you a little bit about asthma, what it is, and some of the ways you can help manage it. So what asthma is, it's known as what we call a reactive airway disease. What's happening is your airway is actually tightening, making it weirdly harder to exhale than to inhale. The thing is, this does feel like you're suffocating because you can't get adequate oxygen for your body's needs. Typically, asthma can be triggered by a number of different things. Food allergy can trigger it, as was my case. It can be triggered by environmental allergies. It can be triggered by excessive pollutants, or it can be triggered actually by deficiencies of certain nutrients that your body needs to run a normal immune response. Okay, so asthma, once you have it, you get diagnosed, you go to the doctor, they give you a little tool called a spirometer. You breathe into it, and based on your ability to exhale air, that's how you can be diagnosed with official asthma. Now, typically it's often managed using something we often call puffers. These are either an inhaled bronchodilator, so it's an inhaled drug that can actually widen your bronchus to allow better oxygen flow in and out of the lungs, or it's treated using something called an inhaled corticosteroid, or sometimes with an oral corticosteroid that you swallow. And what this drug does is it just reduces inflammation in the system as a whole. Now, these drugs are management tools. They can be very effective in an emergency. In fact, if you suffer from asthma, I always recommend you carry a bronchodilator with you, as it can save your life in a pinch. Neat little trick. If you run out of your bronchodilator, you lose it, and you do start having an asthma attack, drink a big cup of black coffee. Coffee actually has a little bit of a bronchodilating effect, and it can actually help manage the symptoms of an asthma attack in an acute case. Now, it should not be used as a replacement for your bronchodilator, but like I said, if it's an emergency situation, you're not near it, brew up some coffee. Heck, if you don't even have time to brew it, throw a handful of coffee beans in your mouth and crunch away. May not be the tastiest experience of your life, but it may save your life. Okay, so that's one of the ways you can acutely manage an asthma attack. Now, managing your asthma as a whole involves identifying the things that cause your asthma to onset. As I mentioned, for myself, it was related to a dairy allergy. I've seen many patients in my practice where it's related to gluten sensitivities, dairy sensitivities, egg sensitivities, berry sensitivities, corn sensitivities, a variety of different food triggers, and then often compounded with environmental allergens. So some people experience it seasonally. And then there's another form of asthma called exercise-induced asthma, which occurs when you exercise. And what happens is your lungs, the more you use them, they actually build up an irritant in the form of a metabolite from your normal metabolism, and this can actually cause asthma to occur. One of the things I first recommend, tinker with your diet, see if there's a dietary trigger for your asthma, as it can be one of the most effective ways to manage your asthma in the long term. Now, if you do have asthma, and you've got a bronchodilator, you've got a corticosteroid, but you're looking at other ways to limit or manage your asthma or eliminate your asthma, there's a few things I do recommend. One of my favorite things, because asthma is characterized by low levels of an enzyme called glutathione. Now, glutathione is one of your major detoxification enzymes in the body. So low levels of this are associated with having an asthma attack. In fact, higher intakes of acetaminophen, which is a common drug we use to manage pain and discomfort, acetaminophen actually depletes glutathione, and therefore higher intakes of acetaminophen, especially in children, are associated with higher rates of asthma. And this comes from the depletion of that enzyme called glutathione. So I'll often supplement my patients with glutathione as well as with the precursor to glutathione. And the precursor is something called N-acetylcysteine, or we call it NAC or NAC for short. And taking between 1 and 2 grams of NAC a day can help our body to produce glutathione naturally and thus reduce our symptoms of asthma and reactive airway diseases. So it's a very, very effective therapy. Additionally, managing how our body responds to the environment, going through some sort of detox protocol if you do suspect intoxication being related to your asthma can be very beneficial in managing your asthma. Intoxicants can disrupt how our immune system normally works. So doing a detox program can actually remove the toxins that are interfering with the normal function of our immune system. I also recommend vitamin C, zinc, and quercetin, as these three nutrients can, well, two of them are nutrients, one's a phytochemical, but these three compounds can actually help manage our inflammation and help manage our asthma and allergy symptoms. So therefore, by including them in our diet as a supplement, again, between 1 and 3 grams a day of vitamin C, taking about 25 milligrams a day of zinc, and taking about 1,000 milligrams or 1 gram of quercetin. Long term, it can be very helpful for controlling allergies or asthma symptoms, which again are often related to an allergy. And those three chemicals, what they actually do is they actually help to reduce your body's allergenicity, thus reducing the asthma development. So I hope you've learned a few things that you can do to help manage your asthma safely, help ideally get it under control, and improve your quality of life. Check out more videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.